Broadly, dementia is a general term used to describe a group of symptoms affecting memory, thinking, and social abilities that is severe enough to interfere with daily functioning. There are many different forms of dementia, but today, we are going to talk about a specific type called Lewy body dementia, which is a progressive disorder that affects thinking, movement, behavior, and mood. In this video, you will learn about the causes, symptoms, diagnosis, and treatment of Lewy body dementia. Lewy body dementia also has two subtypes that can be diagnosed: Parkinson's disease dementia and dementia with Lewy bodies. These two disorders are very similar, but are distinguished by when certain symptoms appear. Lewy body dementia is caused by clumps of a misfolded protein, called alpha-synuclein, that accumulate inside brain cells. These clumps are what we call Lewy bodies. As these Lewy bodies accumulate over time, they cause neurons to stop working properly and eventually die. Unfortunately, what causes Lewy bodies to form in the first place is poorly understood. Lewy body dementia is associated with many symptoms, which can vary from person to person, largely because Lewy bodies can affect many different parts of the brain. However, symptoms can be grouped into 5 categories. For cognitive symptoms, people with Lewy body dementia often have fluctuating attention and alertness, meaning they may be sharp and focused one moment, and confused or drowsy the next. Thinking becomes slower, and many people struggle with visual spatial tasks, like judging distances or navigating spaces. One of the hallmark symptoms of Lewy body dementia is visual hallucinations. These are often vivid and well-formed. People might see animals, children, or figures that aren't actually there. Lewy body dementia also causes Parkinsonian motor symptoms, such as stiffness, slowed movement, shuffling gait, and resting tremor. These symptoms overlap a lot with Parkinson's disease, as they are closely related. Another hallmark feature of Lewy body dementia is REM sleep behavior disorder, which causes people to physically act out their dreams, due to a loss of the normal muscle paralysis that occurs during REM sleep. Lewy body dementia also involves mood and behavioral changes. Depression and apathy is common and can appear early, leading to low mood, loss of interest, and withdrawal. Anxiety often shows up as persistent worry or restlessness, sometimes linked to confusion or fluctuations in awareness. Some individuals also experience delusions and paranoia, such as believing someone is stealing from them, misidentifying familiar people, or feeling suspicious in situations that aren't actually threatening. Finally, many people with Lewy body dementia experience autonomic dysfunction, such as problems with regulating blood pressure, heart rate, or body temperature. Constipation and urinary incontinence are also common. Lewy body dementia is a clinical diagnosis, because currently, no single test can definitively confirm it during life. Instead, clinicians rely on a combination of symptom history, neurological exam, and characteristic clinical features. One of the most important diagnostic tools is the 1-year rule, which helps distinguish dementia with Lewy bodies from Parkinson's disease dementia. If cognitive symptoms appear before or within 1 year of the onset of motor symptoms, the diagnosis is dementia with Lewy bodies. If cognitive decline begins more than a year after established Parkinson's symptoms, it is considered Parkinson's disease dementia. The core features of Lewy body dementia are valuable for ruling out other causes such as Alzheimer's disease. Clinicians may also use supportive tests to determine an appropriate diagnosis. PET or SPECT scans can show reduced dopamine activity, sleep studies can confirm REM sleep behavior disorder, and myocardial scintigraphy can indicate autonomic dysfunction. These findings help build confidence in the diagnosis, but none of them can confirm Lewy body dementia definitively on their own. There is currently no cure for Lewy body dementia, so treatment focuses on managing symptoms with medications and supportive therapies. Medications may include cholinesterase inhibitors, like rivastigmine, to improve thinking and memory, carbidopa-levodopa to ease movement symptoms, and antidepressants, such as SSRIs, to treat depression. Therapies also play an important role. Occupational therapy helps people maintain independence by teaching strategies for everyday tasks, while physical therapy supports mobility and balance. Together, these approaches can improve quality of life, even though they do not target the underlying disease.